Hello, I welcome you all to the brand new episode of Dr. Sin. This is me, Naina, with you. Today we have a well-known doctor, Varghese, who is a maxillofacial surgeon. He is also specialized in orthognathic surgery. Let us welcome him to the show. Hello, doctor.
Hello, I am Dr. Varghese. I retired from the medical college service.
Doctor, we have heard that you have written 2 books.
2 books which I have written is on orthognathic surgery. The first book is called The Orthognathic Surgery, Aesthetic Surgery of the Face. And the second one is Surgical Correction of Facial Deformities.
Doctor, what is orthognathic surgery?
Orthognathic surgery means surgical straightening of the jaw. That means surgically correcting the deformities of the jaw.
What are the common deformities of the face?
When you consider the common deformities of the face, you might have seen people having a very protruded teeth, or the jaw is completely protruded out. These are the most, and facial asymmetry. Asymmetry means there is no symmetry for the face. And these are the other deformities, and cleft lip, cleft palate, and dish-shaped face, very huge face. All these things are deformities. There is a normal pattern or morphology for the face. If there is any deviation from that, that is what is called a deformity. As I told you, the most common deformity that we see is that, especially in the southern part of India, what we see is that the protrusion of the entire maxilla. So in such situations, people cannot be able to close their lips. Normally, the lips have to be kept closed in a rest position or in a repose. But some people cannot close their lips. The reason why they cannot close their lips is mostly because there is a vertical excess of this upper jaw. Upper jaw is called the maxilla. When there is a vertical excess, naturally there will be length of the maxilla is more and they are not able to close the lips. Another problem that is usually related to the maxilla, that is the upper jaw, is that the retrusion of the maxilla, that underdevelopment of the maxilla. It is usually commonly seen in patients who had undergone cleft palate surgery. Cleft lip and cleft palate is one congenital deformity, that is a deformity which has occurred at the time of the birth, not at the time of the, even during the conception itself. There is this deformity may be there, and the child is born with a cleft lip or cleft palate. Such patients, the development of the maxilla will be completely deformed, and they will have a completely retruded maxilla. That is also another deformity. Yet another deformity that we always see is that they related with the mandible. Mandible, sometimes certain cases it will be very prognathic, because it may be because of the overgrowth of the mandible, understand? And it will be something like a protruded. And that is some cases where there is a trauma to the temporomandibular joint, both the joints, or there is an injury to the joint, that is what is meant by trauma, or some infection to the joint. Sometimes there may be an ankylosis of the temporomandible. Ankylosis means the joints. The temporomandibular joint means the mandible and the joint where the mandible and the temporal bone, that is a part of the skull, is joined together. If there is an ankylosis take place, that is union take place, patient or the person cannot open the mouth at all, and naturally the growth also will be retarded. So they will be having something like a bird face, So very, very prominent maxilla, and the chin won't be there. The entire mandible is completely reduced. These are certain deformities that we usually commonly see. And if there is an injury to only one temporomandibular joint, and the growth is retarded there, and there may be an asymmetry. Or there is something called, the entire site may be overgrown, and that also may be causing a deformity like facial asymmetry. There is one disease, very common, not commonly, but rarely seen, is called hemifacial microsomia. Hemifacial means, hemi means half, facial means of course face, micro means smaller, somia means our somatic system, that is the entire tissue. So hemifacial microsomia means the half of the face is not growing properly. That is what is called a hemifacial microsomia. That is another reason for facial asymmetry. So these are the common deformities that we encounter.
How does deformities occur?
Cleft lip and cleft palate, I have told you that it happens mainly because of genetical reasons, and of course nutritional reasons, other drug reasons. So many other reasons are there by which the consumption, during the formative days in the womb of the mother, this formation of the maxilla and the lip and palate will be taking place in the properly. And in such cases, when the child is grown, there will be cleft lip and cleft palate. That is one. And another important reason for these deformities is developmental. During the development stages, as I told you, if there is trauma to the jaw, naturally the growth in that area will be a little deficient. And such a deficiency can cause difficulty in there. And then there are genetic reasons can be put as one of the major reasons. I told you that, in certain population we see a lot of maxillary prognathism. That is, maxilla is the upper jaw which just protrudes out. And that is developmental and genetical. Specific one reason cannot be specified because these are certain things that which we are not able to prevent because it is basically developmental and something related with genetics as well. Understand? That is one of the reasons.
Doctor, how do you correct these deformities?
Correction of these deformities is a major surgical procedure. Well, our bone has got a tremendous capacity to heal. Probably there are only few tissues which can regenerate. Our skin can regenerate, our bone can regenerate, but our muscles cannot regenerate. It heals by scar formation or fibrous tissue formation, but bone by tree formation. So healing is comparatively good for the bone if there is a proper blood supply and nutrition going into that region. Now, because of the technological development, we have got instruments, we have got technology, and we have got the knowledge as well with a lot of research. Definitely we should be grateful for our people, those people who has developed this particular branch. And we can operate, we can go through the mouth and cut the bone into several pieces and then refix it. Cut into pieces and readjust it, cut short or even lengthen it or readjust it, and the entire deformity can be corrected and fix it back so the deformity gets corrected. So to say that it can be said that you can all the jaws, all the bones can be moved in almost all the 3 dimensions of space by cutting it. Okay. So it is something like a deft carpentry. We have to do a little measurements. We have to take certain X-rays, measure it properly, plan it, predict it, and then do a little deft carpentry, as I have put it again, and then fix it and allow it to heal. And within 2 or 3 months' time, everything will be perfectly all right. But one important thing is that when we are doing this surgery, when the bone is moved, naturally the tooth also moves along with that. So orthodontic treatment is also had to be done along with it. So I will put it this way. A combination of orthodontics and orthognathic surgery can sculpt wonders on the face.
Doctor, is it a beautification surgery?
Sure, it is a beautification surgery, but I would prefer to call it rather deformity correction. Deformity correction. And naturally when the deformity is corrected, people become beautiful. Our intention is definitely orthognathic surgery is, as the name indicates, it is straightening of the jaw. It is not for beautification. Actually, it is basically for correction of the deformity. But when we correct the deformity, automatically people will become naturally good. So in other words, you can say that it is to some extent, it is a beautification surgery as such.
Doctor, can you tell us about the problems associated with facial deformities?
The problems associated with facial deformities multifold. One of the important problem is that loss of function. If the face is not in the right position, you are not going to get a proper function. Number one. Number two is psychological. That is probably, I would say, is one of the most important. Children, their character formation takes place between the age of 12 and 20. During that time, if they have got a deformed face, their peers, colleagues, students, and even some of the elders even, make fun of them. That is a tremendous impact on their psychological development, their personality development. This is something which has to be addressed very clearly. So in such situations, definitely correction has to be done as early as possible. Otherwise, I know many of the young children who has become rebellious. They don't go to school. They are very, very arrogant. They fight with their colleagues. They don't take care of their hygiene habits. They don't brush their teeth. And naturally, even if they have got a talent, they don't express it. So these are certain problems that they encounter if there is a deformity. And naturally, they become introverts. They lose their self-confidence. And naturally, they will be dropped out from the mainstream of the society. The other problem, minor problems, if it is there, these psychological problems may not happen. But functional problems can occur. The function of the jaw is mainly chewing and, of course, expression. Face moves define human expression. Man is the only animal who can smile. And smile is definitely the face. And it is always said that face is the index of the mind. So a beautiful face is definitely something everybody longs for. So that is something very important. So to get a normal face at the least, even if it is not beautiful, that is very important for so many things, function and psychological reasons.
Doctor, how do you assess beauty?
Have you heard about golden proportion? No. There is something called a golden proportion. This golden proportion is decided, put forward by Phidias. And this proportion is called 1:1.618. If that proportion, you just look at the main arts by Michelangelo, Da Vinci, and many others of that age. Most of the pictures have got this particular proportion, 1:1.618. This proportion is there, we can see in everywhere. Then there is something called a Fibonacci series. That is, if you take 1, 2, 3, 4, and if you add 1 plus 1, 2, 2 plus 1, 3, 3 plus 2, 5. Like there are another adjacent two numbers when you add, you get to the next number. So now just imagine 0 plus 1 is 1. 1 plus 1 is 2. 2 plus 1 is 3. 3 plus 2, just number, 5. 5 plus 3 is 8. And you divide 8 by 5. It is almost 1.6. And 8 plus 5, and divide that number by 8. Again, you get 1.6. That is what is called a Fibonacci series. This particular proportion is seen not only in maths, in the nature. For example, in Nautilus shell, that is shell, each shell, the next shell is almost 1.618 greater than the previous shell. So this is supposed to be a beauty proportion. And this beauty proportion is always seen in the face. So this proportion, if it is there, we can almost say that it is beautiful. That's all. It is basically the proportions. I'll tell you a few things that how we assess beauty. One is the hairline, and this particular portion is called the glabella, and this portion is called the subnasal, and this portion is called the mentone. This is equal, almost equal, almost equal. From here to here, from here to here, and from here to here is equal. If there is a disproportion, there is a problem. That means it is not really beautiful. And again, from subnasal to this region, and from this region is to 1:2. This is 1 and this is 2. If that is there, we call the face is almost normal. Understand? And you can just draw a perpendicular line from here, in the normal horizontal, and then when a person is sitting quite straight, and if you draw a line from here down, This line is expected to go through the upper lip margin, 2 millimeters anterior to this margin, and somewhere around 4 millimeters anterior to this margin. These are certain proportions of the face, and which we always look into and assess and decide where exactly the deformity is, and then we plan the treatment. Understand? If this area is comparatively protruded out, then we cut it short and then push it back. If this length is more, we cut it here and then take it upward. If it is projecting out, we cut it in this region and push it back. So that is what I said, that you can cut the bones into any number and remove certain things, or add bone grafting or something can be done, and then it can be fixed back and it will heal in the normal position. That is what is being done. So that is what is. So now understand, there are certain proportions for beauty, and though Shakespeare has said that beauty lies in the eyes of the beholder, and of course John Keats said that a thing of beauty is a joy forever. Yes, both are right. But we scientists can almost, though you said that it's a subjective matter, we have converted this subjective matter. Not only we, scientists, but the artists as well, has converted this subjective matter into an objective matter. And now when it is an objective matter, we can very well assess it. That is a proportion that we see.
What is the ideal time to do the surgery and at what age?
The ideal time to do the surgery is after the growth period is completed. Because the deformity will go on growing till the growth is completed. The growth spurt starts from somewhere around 9 years to 18 years. So we prefer to do in adult males, maybe it is up to 20, 21, 22. For females, up to 18 plus 1 or 2. That is the time for the growth completion. For males, grow a little more, little further. So the ideal time is after the growth is completed, so that there won't be any further growth. When you correct the position and we change the bone into a particular position, fix it, it remains there. But if you are going to do the surgery at an early age, naturally, as they grow, the deformity may, to some extent, may come back. Well, then there is a little problem. I have already told you that the psychological impact on the children, when even the age of 9 or 10, it may be there if it is a deformity. If you are going to wait till 20, 21 for them, who has got a psychological problem, their character is formed. And even if you make them really beautiful, they are not going to get their character back because it is imprinted into their psyche. So, in such situations, children where there is a very gross deformity and who has got a psychological problem, you should do the surgery early enough. And maybe you may have to repeat the surgery after the growth is completed. But at the least, during their growth period, you will be able to reduce the deformity and give them a comfort to allow them, to get them a comparatively good personality development. That is important. So, ideally, it is after the growth is completed. But if there is a psychological problem for the child, you have to do it early.
Doctor, how it differs from orthodontia?
Ortho, as I told you earlier, means straight. Dontia means tooth. So, orthodontia means straightening of the tooth. It is basically, tooth has got a capacity to move if a force is applied on the tooth. So this particular principle is being used in correcting the deformities of the tooth or the malalignment of the tooth. That is more the right term. If the teeth are crowded or if there is spacing, that can be corrected by orthodontic means. But if the deformity is on the jaw, that is why it is called orthognathic. Gnathia, I told you, it is jaw. So orthognathic means surgical correction of the jaw. The other one is orthodontia is straightening of the tooth, put it that way, or aligning of the tooth. Understand? So when the jaw is moved, naturally the tooth also moves along with the jaw. So orthodontia has to be combined with orthognathic surgery. So these things always go hand in hand. So orthodontia along with the surgical procedure can make a lot of the changes in the face.
Okay. What are the other cosmetic procedures you maxillofacial surgeons do?
Well, a very interesting question. We are not only doing orthognathic surgery, we do a little cosmetic surgery as well. For that matter, when there is a soft tissue defect, bony changes may not be able to make anything on the soft tissue defects. Definitely, bone forms the basic architecture or basic framework of the face. But if there is a deformity, a deficiency on the muscles, that has to be corrected. One of the in thing right now is that fat grafting. Fat can be taken, especially from the abdomen, by needles and aspirating fat, and the fat can be implanted where there is a defect. So this is basically, if there is a soft tissue deformity, these things can be done by fat grafting, or there are certain implants are available. Elastics are there, and there are something biopore, medpore, and all those things. There are so many other polyethylene materials are there, which is biocompatible. These things can be also implanted on the bone so that a bone grafting can be avoided. In certain situations, we do even bone grafting if there is a bone defect and which cannot be corrected by orthognathic surgery alone. Sometimes we take bone from the iliac crest, from the rib, or from any other part of the bone, or even from the calvarium, we take the bone, and then that can be placed over the bone as an onlay, and that can be corrected. All these procedures can be done by the maxillofacial surgeons do all these procedures. And scars, accidents and injuries can create scars on the face. Scar revision, remodeling the scars, all these things can be done. Even rhinoplasty, a good number of the maxillofacial surgeons are into rhinoplasty as well, deformity of the nose correction. That also comes in the purview of the maxillofacial. ENT surgeons do it, plastic surgeons do it, maxillofacial surgeons also do this.
Doctor, we heard that a recent branch called dental implantology is becoming very popular. Can you explain about it?
Some time ago, when a tooth is being lost, they used to take an impression of that area, make a model, and fabricate something in a plastic material, and then put few teeth there in the plastic. It is called a removable partial denture, removable denture. That is a denture, a full denture or a partial denture, whatever. And it is something which can be taken, cleaned, and every meal you have to clean it. Understand? So that is what is called a removable dentures. Later, because it's not an easy thing for a person to remove it every time and clean it. So something like a fixed denture developed. Fixed denture is actually the right term, but common term is called a bridge. And of course, when you construct a bridge, you need two pillars at least to connect this bridge. So these pillars are being used where there is a missing tooth, the adjacent teeth, the side which is on the other side of this gap is being taken as a pillar, and crowns are made on that tooth. Slice it and make a crown on that, which is the size of the original tooth. And then these teeth are connected by another few teeth, tooth-shaped bridge. That is what is called a bridge or a fixed partial denture. And this also is creating a problem, because the force of all these teeth, that bridges has to be taken by this tooth, this adjacent supporting tooth. And not only that, food particles may go in between, underneath this, and sometimes that can create cavities or decay for this abutment tooth. And the tooth is sliced, tooth material is being lost. So naturally there was a search for something which can be put into the bone straight. So this actually happened, we call it something accidental or serendipitous, put it that way. That means there was one surgeon called Brannamark. He was an orthopedic surgeon. He was not a dental surgeon, he was an orthopedic surgeon. He was doing some research with a titanium chamber in animals, that's actually rabbit or mouse. And after the work was over, he wanted to remove that chamber, titanium chamber, and found it very difficult because it was got completely fused to the bone. That means osseointegration. It has got integrated into the bone. He thought that this is something which is good for especially giving teeth, giving artificial teeth. That is where it is to be. Titanium afterwards has become very common in plating, fracture plating, and even fabricating joints, etc. Titanium is being used nowadays. So titanium has found such because it is such a biocompatible material. So titanium with certain alloys like titanium alloy with aluminium and vanadium and all those things, together, a particular alloy is being made, and that alloy is very good and biocompatible with the bone, and that can be put into this can be in the special forms of screws, or it can be put into the bone or screwed into the bone, and over that you can make a tooth. So that is what is called the dental implants. That has become very, very popular now. It is almost as good as our own teeth. And the advantage is that in all the other cases, once the tooth is gone, completely the bone resorbs, bone just completely reduces in size. But if you are putting a titanium screw, it won't resorb because it acts almost like a tooth. So the bone will not resorb. So the bone will remain there. So it is a boon. See, after a total extraction, within no time, within another 2-3 years' time, the person will become looks very old because the jaw size is reduced and everything will just completely crumble down. The size of the face will come down. But if you are going to give an implant, you are able to maintain the height of the jaws or the teeth, and the face will become youthful again. That is one advantage, great advantage. It is a very important invention that has happened somewhere in 1850s. This particular thing has been invented.
Doctor, why is it superior to dental bridges?
I think that I have already in a part mentioned it. Bridges, you have to trim the adjacent teeth. Where there is a toothless area, the adjacent tooth has to be trimmed to support the bridge as a pillar. But in this case, there is no need of trimming it off. You can directly fix it onto the bone. But there are certain limitations as well. The quality of the bone, the quantity of the bone, all these things are certain important things that has to be taken into consideration when you are putting an implant. Another important thing is that you cannot put implant in all the patients. Usually we put it after a particular age is completed. I mean, they should be basically adults. And young children, we don't want to put it. And another thing is that we don't want to put implants on a smoker, heavy smoker, because heavy smokers, they will have a compromised blood supply. So if that is the case, probably there may not be enough blood supply to that region. So smokers, we don't want to put it, and maybe we don't want to put it on medically compromised patients. The ones who has got heavy diabetes, they cannot, in that patients we cannot put implants. And those who have undergone radiation, and the patients who has got HIV or AIDS, that is a correct term, acute immunodeficiency syndrome. Such patients, we don't want to put the implants. So certain limitations are there for the implants.
Doctor, thanks a lot for being a part of our show. So that was Dr. Varghese Mani with us. Until we see next time, it's me, Naina, signing off.